Welcome to the deep dive. Today, we're tackling something that's generated quite a bit of buzz. We're connecting Ozempic, the drug many associate with diabetes and weight loss, with something seemingly quite different. Dementia care. Is it hype? Or is there real science here? We're going to dig into our source material and try to separate, well, fact from speculation.
Absolutely. And that's really the goal here. There's so much medical info flying around. It's easy to get lost in headlines. We need to look deeper, understand the nuances. So for you listening, we want to pull out clear, actionable insights from what we reviewed, give you a really solid perspective on this.
Okay. And the main source we're drawing from for this deep dive is excerpts from The Truth About Ozempic, Can It Help Patients with Dementia by Marco Aurelio Gomes Vallado.
Yay! All right, so before we jump into the brain connection, which is fascinating, let's lay some groundwork. Ozempic, we hear the name a lot, but fundamentally, what is it? What's it actually doing in the body? Okay, yeah, good place to start. So Ozempic is the brand name for semaglutide. It's an injectable medication. Its first job, its primary approval, was for controlling blood sugar in adults with type 2 diabetes. It's part of a class called GLP-1 receptor agonists. Now, agonist just means it mimics something natural.
Mimics what exactly?
It mimics a gut hormone called GLP-1. Our bodies make this naturally. And this hormone does a few things. It tells the pancreas to release insulin, but only when blood sugar is high. It slows down how quickly your stomach empties, which helps with feeling full. And it can reduce appetite signals in the brain.
Hence the weight loss effect everyone talks about.
Exactly. That's the sort of secondary effect that really made it famous recently. But here's the really interesting part for our discussion today. Those GLP-1 receptors, they aren't just in the gut or pancreas. They're actually found throughout the brain too.
Okay, that is key. Receptors in the brain. So it's potentially doing more than just managing blood sugar or weight, which leads us right to the core question. How does this drug start to connect with something as complex as, well, dementia? The source mentions early studies. What are they showing?
Yeah, this is where it gets really intriguing. The research is still early, we need to stress that, but there are connections emerging. It seems to work on a few levels. First, indirectly. We know that conditions like type 2 diabetes and obesity are pretty significant risk factors for developing dementia later on.
Right, those links are well established.
So if Ozempic helps manage those conditions, effectively gets blood sugar under control, helps with weight, it might indirectly lower dementia risk just by improving overall metabolic health. Think of it like improving the body's whole environment, which naturally benefits the brain too.
That makes sense. Improving the baseline, essentially. Does the research suggest anything more direct, though? Something acting specifically on the brain itself, beyond just fixing the metabolic issues?
Yes, and that's the second, perhaps more exciting area. Again, early days. But some research suggests these GLP-1 agonists might have direct neuroprotective effects. This could involve reducing inflammation in the brain, which is a big factor in diseases like Alzheimer's, and potentially protecting neurons from damage.
Okay, so reducing inflammation and protecting brain cells. How is that where those brain receptors come in?
Precisely. The thinking is that activating those GLP-1 receptors in the brain could trigger these protective pathways.
Yeah.
And there's a third aspect too, blood flow. Better blood sugar control means healthier blood vessels everywhere, including the brain. Good vascular health is absolutely critical for brain function.
Right. Impaired blood flow is a known contributor to cognitive decline and dementia progression.
Exactly. So you've got this potential three-pronged thing going on. Better metabolic health overall, possible direct neuroprotection, and improved brain blood flow.
Okay, wow. So given these potential benefits, even if they're still being researched, it leads to the big practical question. Should people actually consider using Ozempic for someone who already has dementia?
That's the million-dollar question, isn't it? And the answer, according to the source, is nuanced. It's a definite maybe under certain conditions. The key point is if the person with dementia also has type 2 diabetes or significant obesity. These conditions are, unfortunately, quite common alongside dementia.
Right, comorbidities.
Yes. So in that specific situation, Ozempic could be a really valuable tool, not primarily for the dementia, but for managing the diabetes or obesity. The idea is that by getting those underlying conditions under better control, you create a healthier, more stable foundation for the person overall. And that improved stability, that better general health, might indirectly help with managing the dementia symptoms, or at least slow for the decline related to those metabolic issues.
So let me make sure I'm hearing this right. For everyone listening, it's not being suggested as a direct dementia treatment itself. It's about treating other conditions the person also has, which could then have a positive knock-on effect.
Exactly right. It is absolutely crucial to understand. Ozempic is not a magic bullet for dementia, not at all. The source strongly emphasizes this. Any decision to use it, especially when dementia is in the picture, must be made with a doctor. A healthcare professional needs to look at the whole picture. The patient's full medical history, all their conditions, potential risks, potential benefits. It has to be individualized.
It really has to be part of a comprehensive plan then.
Absolutely.
Which really underscores something we talk about a lot. Good dementia care isn't just about the brain, it's about the whole person, right? Managing everything that's going on.
Couldn't have said it better myself. That holistic view is vital.
Okay, so let's try and wrap this up. What are the main takeaways here? What should you, listening at home, really understand about Ozempic and dementia?
Well, I think the first thing is that this connection is a really exciting area of research. It's ongoing, it's evolving. Ozempic and drugs like it do show potential for brain health benefits, likely through those multiple pathways we discussed. But its main job, its approved use, is still managing type 2 diabetes and obesity.
And for dementia care specifically.
For dementia care, it might be helpful if the person also has those metabolic conditions. It helps manage those, creating a better foundation. But it's not a dementia cure. The big message is the importance of managing all underlying health issues. It's that holistic approach again.
Right. So if this is something you're thinking about, maybe for a loved one, the clear advice is talk to their doctor.
Definitely. That's non-negotiable. The doctor can assess if it makes sense in their specific situation, weigh the pros and cons. It comes back to treating the whole person, looking at how managing one aspect of health can positively influence others, including cognitive function.
It really makes you think, doesn't it? This kind of research, seeing these unexpected links like between a diabetes drug and brain health, how might this ongoing work change how we view the body's systems? Not as separate silos, but as deeply interconnected. And what other surprising connections might we uncover down the road as we keep searching for ways to improve holistic health? Something to ponder.